about really.
Oh, thank you, Dr. Nasser. Assalamu alaikum jami'an, and welcome to this workshop organized by the Continuous Education Unit and the Quality Assurance Division at the University of Baghdad College of Pharmacy. Today, we are very happy to have Professor Naser Alsharif, Dean at Lebanese American University College of Pharmacy. I think those of you who continuously attend continuous education workshops probably recognize Dr. Naser and the excellent content he always share and provide. So we always come back to him for more. Dr. Naser is a professor of pharmacy, had a pharmacy degree. He was previously the international coordinator at Creighton University College of Pharmacy. He has a very long history in education, and besides pharmacy, in pharmacy education, he is part of ACP international accreditation team. And today we are happy to have him to talk about curriculum delivery methods. Thank you for joining us, Dr. Naser. We're very happy to have you with us today.
Thank you. And thank you again, Dr. Kausar, for always doing such a great job with faculty development. I've attended quite a few of the ones that you've done, and you've done a great job. And I appreciate you giving me the opportunity to always be with you and to present to colleagues in Iraq. Iraq is very dear to all of us, and used to spend our vacations there when we were young, and God willing, I'll get the opportunity to come and visit there. So thank you, such a pleasure to be with you. This was a topic that Dr. Kauthar asked me to speak about. I hope what I put together will kind of serve your purpose. Please, at any time, if you feel I'm going in kind of the wrong direction or not really addressing what you need, and especially you, Dr. Kauthar, stop me and ask questions and so on, and hopefully will make this beneficial for all of us. So the title of the presentation is Curriculum Delivery Methods, and just kind of the outline based on what Dr. Kauthar asked me to do is, I'll do a little bit of introduction, some definitions. My understanding is you have a vertical kind of model for your curriculum. So we'll talk about the vertical model, the horizontal, and an integrated model for the curriculum. Then we'll talk about the components, and really the components of a curriculum, it doesn't change whether it's a vertical curriculum, horizontal, integrated, a spiral curriculum. So there are different types of models and so on, but today we'll emphasize again the vertical and touch on the importance of why also horizontal is critical, so that it'll be an integrated curriculum. Dr. Kauthar also asked to discuss delivery methods, assignments, assessments, and other components relevant to the vertical model. For any presentation that I do, I hope as we do it, you really think about the implications for you, at the University of Baghdad, but also in general in terms of education in Iraq, and love to hear from you as we start the discussion. So when we talk about a curriculum, really it is what we teach, and the knowledge, the skills, and hopefully the attitudes as important that we expect a successful student that finishes our program will acquire by the time they finish. Sometimes we call this the explicit curriculum. Other times you might hear it being mentioned as the core curriculum. So either one is fine. And the curriculum really systemically describes the content, the sequence of that content. That's where a vertical curriculum comes in place. How do you really have the courses aligned in the first semester, second year, and so on, and moving forward and so on. Also the educational experiences, and as important, the assessment processes. Assessment has become really critical over the last 10, 15 years. I don't think we have done as good of a job before. Certainly in pharmacy, I believe over the last 15 years, we've done much better than many other disciplines because of the emphasis on quality and accreditation and standards and so on. So the key thing really, all of that comes in place to achieve the curriculum goals and objectives. And those can be based on standards from the Ministry of Education. And we talked about that last time. We were looking at quality in education and so on. It could be based on professional publications in the United States. There is the CAPE outcomes and other outcomes that people look at in terms of establishing the curriculum. Very, very important. I think the key thing is when we talk about a curriculum, we design it, we deliver it, but the key thing is we want to monitor it. And it needs to be monitored first and most by us as faculty. We are the guardians of the curriculum, and we need to really make sure that we do our job. Certainly, preceptors are important, especially those that are full-time with the university, but even part-timers are important, very important in terms of the monitoring. In our school at LAU, we actually have an assessment officer, and she has a master's degree in assessment, and she does a fantastic job in looking at our curriculum and other aspects. We'll talk about that later to make sure that, again, the curriculum is monitored all the time. It builds on a pre-professional foundation. All of us, we have a pre-pharmacy program. There are scientific courses. There is liberal studies. Again, at LAU, we just adopted a new liberal art curriculum and emphasis on the humanities, justice and service and other issues that we feel are important for our students. So the pre-pharmacy curriculum is as important. You always need to look at it as you build vertically, horizontally, and integrate all that content together. It's really, really critical. Based on that, most professional programs are 4 years and about 126 credit hours to complete the program. A key thing also that we should not forget, we talk about the explicit curriculum, but every school has a culture. That culture can be a very positive culture. That culture can really support the curriculum, the core curriculum, the explicit, but sadly, sometimes what we do as faculty, what the staff does, the whole environment can give the students a different kind of idea about really what is it that we're trying to do with the curriculum. The way we behave, the way we interact, the way we show respect or we don't show respect, all of that is critical. So the implicit curriculum is what the students observe, the culture that exists on a daily basis, the behaviors, attitudes, and so on that they see, what are our expectations of them, and so on. All of that ultimately will affect what they think in terms of what the actual curriculum is and what they're seeing in terms of the culture of the environment they live in. So to simply define vertical curriculum, you build upon the knowledge that the students are getting, and as the students move from one semester to the next, and certainly from 1 year to the next. And you link that knowledge so that the concepts from one course to the next is built upon vertically as they move from the first year, from the fall semester to the spring to the fall, and so on. So that kind of is done vertically. Horizontally is really as critical. We need to look at what are the courses that are being taught in that semester, even though those courses might be different disciplines, but how can we help each other in meeting the curricular outcomes? Calculations is a very good example. I think every course should challenge students in calculations. I don't know what it is with young people these days, but calculations is a major challenge. Communication skills, there might be other things that you have identified. So again, horizontally and integrating them across different disciplines, different courses is also as critical. So in my opinion, I feel we always need to think about the vertical, the horizontal, where yes, certain concepts can lend themselves to be integrated vertically because certain courses kind of build on each other. But even with courses that are different, we can still build a curriculum that support each other with concepts that we feel should be across all disciplines. And that's when we truly can have an integrated curriculum. When we talk about vertical and horizontal integration. And I'll stop here to really emphasize one point. A lot of times we depend on the curriculum to do a lot, but ultimately it is an individual responsibility. It is so funny that we tell our students, you need to integrate everything we teach you, but we don't do it, whether it's as social administrative faculty, whether as a science faculty or as clinical faculty. We also have a responsibility to integrate the curriculum to show them as role models how we integrate. So even though I am a toxicologist, I ended up teaching medicinal chemistry. I had to find ways to integrate medicinal chemistry to make it clinically relevant. It is a duty, I think, for all of us in basic science to show how our courses are relevant, very important for the students. It kind of captures their attention and so on. So it really clear to emphasize, yes, we can build the curriculum and so on, but ultimately it is an individual responsibility for us to also help the students be role models to integrate the curriculum. So all learning activities helps the students build connections between topics, and the curriculum becomes relevant as a curriculum and also within each one of us in terms of what we do in our courses. Very important. I think all of us, I should say, when we look at curriculum design, we start by thinking, where should this course be in the curriculum, and what course comes next? So that is an important exercise with a vertical curriculum that should be done. We've always struggled in terms of, should medchem and pharmacology be taught together? Should medchem be taught first, or should they be integrated? That's another kind of important question. The same thing, when do you introduce therapeutics? When do you introduce ethics? When do you introduce jurisprudence? When should the students learn about the law and so on to be able to kind of do their early practice experiences and be knowledgeable? So a lot of thought should be in that mapping of placement of courses, so that when we talk about a vertical curriculum, that the alignment of these courses and where they're introduced is also well thought of, and it could be different based on different countries and so on and practice. So that is another key thing to keep in mind. When we talk about components of the curriculum delivery, in our school and in my previous school, Creighton University, we had a model called the IRD. The I, if we have time, I would have asked you to put it in the chat. What do you think the IRD, or maybe you're familiar with, let me open the chat. Anybody familiar with the IRD model or the IRA model and what it stands for? Or you can unmute yourself and please type in the chat. I don't see anything typed. Well, it is introduce, reinforce, demonstrate, or introduce, reinforce, apply. So as you can see, it is a hierarchy in a sense. We want to introduce concepts. We want to reinforce concepts. In my old curriculum at Creighton University, we used to talk about the small d, where the students have to demonstrate at the level of each course. But then we had capstone courses where the students have to demonstrate at a big D, where they combine a lot of different skills and knowledge to be able to address a case study or a journal club or whatever the activity is. So they need to combine a lot of things, and that is demonstrating at the higher level. So it's the big D. It's the same thing with my school now, the Lebanese American University. Instead of demonstrate, we talk about apply. And I think that is critical because, again, mapping that curriculum from a vertical perspective, from a horizontal perspective, you need to be able to identify when certain concepts should be introduced, which courses should be reinforcing them, and ultimately where the student is going to be challenged at the small d or a small a or the big D and the big A. Very, very important. And I would love to hear from you in terms of how you built on that vertical curriculum and how you kind of did the mapping based on that. Aligning your educational outcomes to certification, professional standards. I know you're working on those in Iraq now, and God willing, those will be completed for pharmacy soon. And hopefully that will help you because now you have a target, a goal in terms of what you want to accomplish with your courses and the curriculum that you put together as a collective effort, part of the courses, part of the curriculum, so that you align them with the educational outcomes that you're going to meet. Meeting these educational outcomes, again, based on the core knowledge acquisitions, the skills that you kind of help the students to master during the curriculum, and the ability to apply them to different practice settings. And this is really critical. In the United States, and some of maybe my discussion might be biased because maybe it is catered more for clinical pharmacy. You need to really think about where your students are going, and that knowledge, the skills, those need to apply to the different practice settings. At LAU, we're going to be introducing a course in veterinary pharmacy. That is something that I felt is important to help the students get that knowledge, and God willing, maybe work in an animal hospital or an animal clinic as a pharmacist to help with the needs. So industrial pharmacy is really critical. It wasn't as emphasized. Now we're going to be introducing, with the help of a couple of pharmaceutical companies, courses in industrial pharmacy. So again, don't bias yourself in terms of clinical pharmacy and so on. Look at where you want your students and vertically align your curriculum to help the students meet those educational outcomes for what you need ultimately in those practice settings. Active learning pedagogy, and we'll talk about that, whether teaching and learning methods, and we'll talk about those, and I'm sure you have implemented many of these active learning pedagogies that we'll talk about. Curriculum integration, I already talked about that, and again, doing it both horizontally and vertically within the same semester, where people kind of talk to each other. And that is so key, communication. Every semester, when it's done, there should be, if we want to talk about, is our curriculum working, the vertical aspect of it, or the horizontal, the spiral, whichever way we're aligning it, there has to be communication between the faculty, sharing their experiences. Many times you would hear, I'm discussing the antimicrobial drugs, and students are not comfortable with what is gram-positive, gram-negative. You know, if we don't go back and look in the curriculum, what's going on? Why do they say that? Why they're not comfortable with identifying bacteria that is gram-positive, gram-negative? So you could give a lot of examples and so on. So communication is so critical to make sure we are doing this in the right way. Teaching techniques and strategies that address the diverse needs of students. More and more students are coming to us with different needs. Some of them, they have some cognitive kind of abilities that need to be addressed in the way we give lectures. There might be some other issues in terms of physical abilities that we need to address. Cultural issues are important and so on that we need to look at. So again, how do we meet those? We should not forget about the elective and their role in the curriculum. You cannot teach everything. In fact, sadly, in most pharmacy school, we have what we call curriculum hoarding. We just keep dumping more and more stuff, the same credit hours, and the students are overwhelmed. We need to really be cautious of that and prevent this hoarding that happens in most schools, and to really identify a role for elective courses to support and help with certain kind of practice, knowledge, experiences, skills. They can play a major role. The same thing with elective experiential experiences. Very, very important. We are trying to establish an experiential experience with the hospital in bariatric surgery, where students get the experience from pharmacists how to dose drugs after bariatric surgery. That will be an elective rotation, but that is a job opportunity if they become experts in terms of dosing of drugs. Because in Lebanon, in the United States, I know I've been in Abu Dhabi Cleveland Clinic, they do bariatric surgery. One of my colleagues who's a bariatric pharmacist, she was such support for them because they didn't have a pharmacist. So again, what kind of experiential experiences can lend themselves to provide better opportunities for your students as you think about your curriculum is important. The educational aspects are important, but the logistical aspects also of the curriculum are as important. We need the curricular oversight, the assessment committee, the curriculum committee, the right representation, from the pharmaceutical sciences, from the social administrative faculty, from clinical faculty. All departments should be represented, students, alumni. So the alumni can play a major role with curricular oversight and having them represented. We need to allow for timely, formative performance feedback to students in both didactic and experiential courses. Very important, because ultimately we're looking at, is this curriculum working? And if the students don't get really timely feedback, especially in the last years in the experiential experience, at midpoint of the rotation, at the end of the rotation, so that we really gauge, are they meeting those educational outcomes? This is where we kind of hone in clearly on, is the curriculum working, regardless of what the experiential experience, because we're setting them in the first 3 years or 4 years to succeed in the experiential experience and ultimately to be practice ready. So very critical, very important that we are able to do that. Same thing, we need the students to be provided the opportunity to give formative and summative feedback to faculty, to preceptors in the program. Most programs will do an exit survey for their graduates. And that is so critical, so important to really assess what the students tell us about the overall experience they had with our curriculum. Very important. Didactic and experiential curriculum review and quality assurance, we've talked about that. Very critical. Having an assessment officer, somebody with a PhD in education is critical. Many schools are also hiring people in that respect because they feel the value of somebody helping in that perspective. And measures to ensure the academic integrity of the program. I cannot overemphasize that. When I arrived here at LAU, one of the main things that I asked the Associate Dean for Academic Affairs to really let me know all the things that we have in place to ensure the academic integrity of our program. No program can afford to really slip on their academic integrity, especially a professional program where the students are going to be impacting the society in terms of their health with very specific kind of expertise, drug therapy and optimizing drug therapy. We cannot really graduate students that have any question in terms of their integrity and the way they graduated from the program. So very critical, very important aspect of, again, assessing the curriculum from that perspective. Ultimately, what we want in any curriculum is ensure the breadth and depth requisite knowledge, skills, attitudes, and behaviors required in a discipline. For us, again, in pharmacy, we talk about the foundational knowledge, and that is usually the biomedical sciences, the pharmaceutical sciences, the social administrative, and of course, the clinical sciences. But also we require our students to develop many kind of skills. We want them to be problem solvers, critical thinkers. We want them to be an educator. We want them to be good communicators, advocates, collaborators. We want them to be culturally sensitive. We want them to be leaders. We want them to be professionals. Again, all of those need to be addressed in the curriculum so that when they graduate, they can exhibit both the characteristics and the skills needed to be a professional, to be a communicator, an effective communicator, an advocate for their patients and for the profession. So critical, so important. Provide opportunities to explore diverse areas of interest. I cannot overemphasize that. Again, more and more, even in the Arab world, we're looking at clinical pharmacy. Yes, clinical pharmacy is critical, important, but we need to really think about the need of the country, the need of the community that the university is in, and what we need to train our students in as pharmacists with the knowledge, the skills, and attitudes that help them excel in different areas. I mentioned veterinary pharmacy. Informatics is something we're trying to do here that is huge. Digital health is becoming big. One of our graduates have developed 3 apps, amazing apps that help from the drug perspective. And now he's going to be teaching a required course, an elective course in our curriculum, and 2 workshops in digital health. So again, keep thinking out of the box in terms of what are the needs of our communities and how can we equip our students with the knowledge, the skills to help as they graduate. And again, we want them to build a sound scientific and clinical knowledge, and I cannot overemphasize the scientific. And I could even add the social administrative, because that's all about the attitude, the ethics, the morals, very critical, very important, very important. And ultimately, any curriculum, really, they need to make the student practice ready. Vertical, horizontal, integrated, spiral, any curriculum, that's ultimately, and for us as healthcare professionals, we want our students to be practice ready. And especially in the diversity of the pharmacy areas, absolutely, we need our curriculum to help the students to at least develop some of these knowledge, skills, and attitudes. You're all familiar with the Bloom's taxonomy. I don't want to drill through this. I will provide these PowerPoints to the PowerPoint and maybe some other handouts to Dr. Cowther to make it available for you. But it is really critical at the course level, but ultimately as you do the introduce, reinforce, demonstrate, or introduce, reinforce, apply, where are we in the curriculum? Are we embarking knowledge on the students, or we want them to comprehend, or we want them to apply? And what are the verbs, the action verbs that really describe clearly what we're trying these students to achieve? And ultimately, what are the delivery methods? Is it just a didactic lecture? Is it showing them some visuals and so on? Provide examples, analogies, illustrations, and so on. So again, very critical at the course level. And as we move up the hierarchy of Bloom's taxonomy, as we want them to analyze, synthesize, evaluate, now we're testing them with case studies, problem-based exercises, projects, critiques, simulations. We do OSCEs here at LAU in our simulation lab and so on. So again, very critical for each one of us as we build our syllabus and to help with this introduce, reinforce, demonstrate, how can we really challenge the students at the different levels based on where they are in the curriculum, and really even increase the level of how we challenge them to a higher level, because that is what's required for us as part of this vertical curriculum to challenge the students. As important, and we don't do as much with this as I would really hope in pharmacy, to look at the Kraftfeld's taxonomy, which is the affective domain. This is an example of the Bloom's taxonomy, moving up the hierarchy. I teach medicinal chemistry, and how do you set up your lectures at the knowledge level to help them address concepts in organic chemistry, other stuff that they've learned, and ultimately to learn about the SAR, but then how to apply the SAR, and ultimately how do you do applications based on case studies, based on the structure-activity relationship. I developed a concept called structure-based therapeutic evaluation, I require them to look at the structure, and based on a case, they make therapeutic decisions based on therapeutic criteria. And that's how I move them up the hierarchy of higher level thinking to ultimately be able to conduct an SBTE analysis on a patient case and really make therapeutic decisions based on analyzing the structure and predicting pharmacological activity, and ultimately make therapeutic decisions. This can be done in any science course. And our science courses actually are the ones that really lend themselves to challenge the students to think critically. So I think it is so critical, and we can support the curriculum tremendously from that perspective by making sure that we do move up the hierarchy. Yes, we introduce concept, reinforce, but ultimately we challenge them to analyze, demonstrate, synthesize. Very critical. As I mentioned, there is a Krathvold's taxonomy, which is how you move up the hierarchy so that the students exhibit the right attitude. We emphasize always the affective domain, the cognitive domain. We need to as much emphasize the affective domain. There is hierarchies in that. We want the students to receive. This is how I do it, again, in my medicinal chemistry course, to help them receive that knowledge. But then ultimately, you want them to respond to that knowledge. Ultimately, you want them to value the knowledge, even though it's medicinal chemistry, which is a course that many students feel, oh, why am I learning this, and so on. Interesting enough, when we started applying these instructional model and look at Krathvold taxonomy, we went from students saying as high as 30% that medicinal chemistry is not relevant, and we went down to barely 5% saying it's not relevant, and 98% saying that they will use the knowledge in therapeutics, that they will remember the knowledge even in their practice, and so on. So again, when we build something in terms of vertically in a course or in a curriculum, we really need to ultimately help the students characterize what we're trying to teach them, including loving what pharmacy is all about, advocating for pharmacy, being ethical, being moral. So all these things we want them to characterize are as much important in a vertical development of these students, so that ultimately, yes, they have the skills, the knowledge, but as important, they have the right attitude to practice as a pharmacist and characterize the key characteristics of what we expect in a pharmacist. So real quick, in terms of delivery methods, you're familiar with a lot of these. Many of you most probably use audience response system, case studies, co-curricular activity. We'll talk about that shortly. I use debates. I also teach ethics. So we do a lot of debates depending on what the topics are. And it's very enriching, very kind of helpful to see the interactions between the students. A didactic lecture by itself, of course, is not really active learning, but if you make it interactive with activities and games and other things, certainly flipped classroom games are ways to deliver interprofessional activities. We have courses that are interprofessional in nature with nurses, pharmacy, and occupational therapy, medicine, and so on. And that is excellent in terms of helping students learn and really look at where we're heading with the curriculum, especially if we emphasize interprofessional education. Minute write-ups in the classroom, panel discussion, role play, simulation. We have an amazing simulation lab here at LAU at Creighton University. A lot of great activity based on communication skills, conflict resolution, patient safety, and so on. Student presentations, think, pair, share in the classroom, where the students, after discussions of certain topics, they get together and they explain things to them. And I'm sure there are many other activities to deliver. Another key thing, you really cannot deliver any curriculum vertically, horizontally, spirally, and so on, without emphasizing how you can enhance instructor-learner interactions. I have an open door policy. I respond to emails. I tell them within 24 hours. Again, to the maximum we can, how can we work on that? How can we enhance learner interactions? Not too much, group activities, but certainly, yes, why not some small group activities so that they interact each other, think, pair, share in the classroom, group activities in the classroom, case presentations, and so on. So many, excuse me, oops, my apologies. Learner content, how you really help the students interact with the content and make it more kind of engaging and so on. I'm going to give you as an example real quick, if I may. Dr. Cowthar, how we're doing on time?
Very good, Dr. Naser.
Thank you. This is a software that I use. It's called SoftChalk. I develop all my lessons using this SoftChalk lesson. And basically, this is in medicinal chemistry. I have examples in ethics and clinical toxicology. But all my lectures, when the students open them in MedChem, starts with an introduction. I always tell them you cannot go forward without going backwards. Then we introduce the pharmacophore, the structure-activity relationship. Then we apply the structure-activity relationship. Then we summarize the common clinical decisions that can be explained by the structure. And finally, there is cases for them to predict clinical activity based on the structure. The beautiful thing about this software is when you open it, it looks like a web page. There is hyperlinks to help the students review content from organic chemistry, from physiology, from anatomy. This is different, like in Wikipedia, it highlights the symptoms of depression and so on when they click on it. This is the definitions from the DSM-4. So very engaging. What is depression? When they click on this, it opens a true-false question and so on to really enhance their interaction with the content. There is crossword puzzles, there is flashcards, almost everything that you think the students do, it is to help them engage with the content. When we started this, the students really loved it. And we did actually publish a paper about electronic integration of content by using this SoftChalk lesson. And the sky is the limit really in how you build this and build activities and help them remember things. There is videos in here to help them look at different concepts and so on. Again, there's so much stuff out there to help us get the students to engage in the content, but as importantly, to move them up a hierarchy, a vertical way to think from medicinal chemistry or pharmaceutics or whatever. What do we need to introduce? What are the main things that we need to, in this case, medchem pharmacology, then the structure activity, then we want them to apply, then we want them to really be able to make therapeutic decisions, ultimately predict. So again, this is introducing, reinforcing, demonstrating, very important. Each course can lend themselves to doing this. So very critical, very important. Hopefully this kind of help. Let me get back to my presentation. All right. So keep that in mind. We cannot forget about us. Again, the curriculum cannot run by itself. We as faculty, we need to help in many ways. I mentioned how we can also introduce, reinforce, demonstrate in our courses. How can we enhance Bloom's taxonomy kind of levels in what we do, Kraftfull's taxonomy with what we want our students characterize. So we need to have a buy-in. The curriculum committee or the faculty in charge of building this vertical curriculum have done a great job, and they did the curriculum mapping when the courses should be aligned, and it was approved by all of us. We need to buy in, and we need to contribute to this curriculum design and really work on it. Yes, we can be innovative and creative if you find certain ways to really enhance what you do. I was fortunate to find this SoftChalk lesson because I've always done it before where I try to tell them, you remember in anatomy, we all do that physiology, and the students will tell you, the dog ate my notes. I don't know, I don't remember anything. Then I said, well, forget it. Now I get the software that can link to the notes from anatomy, from physiology, the anatomy of the kidney when I'm talking about diuretics, or gram-positive, gram-negative physiology, cell wall, when I'm talking about antimicrobial drugs and so on. So again, be creative, innovative to support this vertical, horizontal aspect of integrating the curriculum. Know your students, know where their level are, so that maybe you need to introduce again or reinforce to help them. Gauge their energy, interest during the lesson. We in the sciences, yes, there is a lot of questioning about the science and does it belong, especially with the push for clinical. So important. The science is the foundation of everything. I'm not a medicinal chemist, but I practice in 5 hospitals as a graduate student, and even when I work as a faculty. And I always say I became a better pharmacist because I teach medicinal chemistry, because it helped me understand why drugs, what they do. We want to instill that in our students and make them really be interested. Show your passion and enthusiasm. Many studies have been done. We actually did a study, a 3-year study, to look at faculty enthusiasm. And yes, it does really awaken the dormant energy in the students. It makes them feel alive. I've had students telling me, you're the only one that can wake us up at 8 o'clock in the morning. Others said, you're psychotic, you're too much energy. So where do you balance things and so on? But absolutely passion, enthusiasm is important, and it lends itself also to help the students characterize whatever you're teaching, because they see you enthusiastic, passionate about what you do. Engage them. Again, utilize active learning methods, very important. Integrate the curriculum. I mentioned first and most, curriculum integration is our own responsibility as a faculty, absolutely. Take the constructive evaluation from the students and act on it. Build on that to really even help the curriculum committee to show them why you're changing things, adopting new things based on student evaluation. Embrace peer evaluation. Invite somebody in the curriculum committee, the chair or person, and somebody to really look at what you're doing and to provide you input. Are you really helping with this vertical curriculum that was built? There is nothing wrong with helping each other to really do a better job in our each of our courses to help the curriculum move forward. Communicate with the curriculum committee. Again, the rationale for course changes, very important. Being culturally sensitive based on your student population. And again, to the best you can, make your content relevant and certainly up to date, and get rid of content that is not needed. We're all guilty as charged, and that's what I mentioned, curriculum hoarding, where we just keep piling up on things without removing things that might not be relevant anymore. Very important. How are we doing, Dr. Cowther?
Very good, Dr. Naser.
Okay, thank you. In terms of assignments, again, I'm sure you're familiar with these exams, case studies, competency and behavioral-based rubrics, individual and team-based assignments, patient cases, journal club, IPs, introductory practice experience. We have almost 1,200 hours of those at LAU, simulation activities, skills assessment to help the students become practice ready. The OSCEs, we have amazing patients that come to our simulation clinic, and we have so many cases, and I participated last spring, and I will be doing that also. I love doing those, and amazing experience for the students to practice all the knowledge, the skills, and the attitudes. Capstone exams, we don't have those, but we're looking at potentially establishing one. We do have a PACOA, which is done by the Board of Pharmacy in the United States. We've done that over the last several years. We'll do it again this year as a capstone exam. And certainly the advanced practice experiential experience are important, and the licensure exam. Some of our students do end up practicing in the United States, so they take the NAPLEX, but they also take the colloquium, which is the licensure exam in Lebanon, which is important because it helps us compare our students to the American students who have taken the NAPLEX exam, but also for the colloquium, how do we compare to other pharmacy schools that are in Lebanon? Very important to be able to do that. So we do have a comprehensive assessment plan to measure the achievement of our curriculum with the IRA model, very important, and how it ties to our mission. And again, talking about formative and summative assessment, the standardized are the ones that we talked about, the OSCEs, simulation activities, and the colloquium is the standardized one, very important. And again, a lot of these might be biased, like I mentioned earlier, based on a clinical curriculum. You need to make sure that those are done to assess whether it's industrial pharmacy, veterinary pharmacy, or any aspect of your curriculum. So we are biased in a sense to clinical pharmacy and so on. So please make sure you think about your curriculum carefully and how the assessment is really addressing the achievement of outcomes based on what you're trying to achieve. And the process has to be a continuous improvement. Dr. Cowther, do you have a co-curriculum as part of your curriculum?
We do have extracurricular activities.
Excellent. It's almost the same. It's called co-curriculum because ACPE, that's what they call it. This is as important because it complements and advances the learning that occurs within the formal didactic and experiential experience. And usually it happens outside the classroom, and that's the beauty of it because the students enjoy that. It could be part of a health fair. It could be part of a service activity with the community. God bless them, our students, when the explosion happened in the port in Lebanon, the pharmacy students were actually, they won quite a few awards for their contribution during this horrific, unfortunate thing that happened, and supporting the community with drugs, getting even water, food, and distributing. So it's not only about, the drug knowledge, it's about leadership, it's about being an advocate, a good communicator, and so on. Very, very important. So they're conducted outside the classroom. These are the key things we hone on: become problem solver, educator, advocator, collaborator, includer, communicator, self-aware, leader, innovator, and professional. And we align them by year in our curriculum. So we work on self-awareness, personal development, then cultural sensitivity, advocacy, interprofessional collaboration and communication, and then emotional intelligence, conflict resolution, leadership, and innovation. So we progress these kind of activities as they move in the curriculum to support the curriculum and to develop these activities. And Dr. Aline Boumaroun is in charge of that. She coordinates all the activities. There are so many activities that they can sign up for. There are required ones, but there are elective ones, and they have to complete all the required ones, but they can choose also to pick from the elective ones. Finally, in terms of assessment, you cannot really think about just the curriculum. You need to assess everything that supports the curriculum, the bylaws, the job responsibilities, whether it's the dean, the associate dean for academic affairs, the committees, their tasks, their responsibilities. What are the indicators for quality that they're doing a good job? What are the quality indicators that shows that the students are achieving their outcomes? Indicators that the faculty are effective, the staff, administrators, preceptors. We call them key performance indicators for each one of those. For example, we just established a post-tenure review for all faculty. So again, because you want to make sure faculty are maintaining their professional kind of knowledge and skills and so on to help in the curriculum and so on. So there is a post-tenure review as part of that, making sure that the program is going to always maintain high quality education and so on. relationship between the dean and higher administration. Nowadays, with COVID and the financial difficulties, how much independence we as administrators, as dean, have to run the school and to make sure we do it without interference from higher administration or dictates. So critical, so important. It's a healthy, important relationship. We need that, but there needs to be some independence so that we can support our curriculum without much interference and so on. The number of faculty we have, staff and administrators, I'm sure in Iraq, as in any other university, ranking is becoming huge. Faculty to student ratio is critical. Faculty to administrator ratio, staff, it's a headache. But sadly, it's a game that many people are playing now. But you need to make sure at least that you maintain the quality by looking at a lot of these parameters, because ultimately they're going to impact your curriculum. Program evaluation by stakeholders, so critical, so important. In a sense, we're lucky because we're ACPE accredited. We have to do the American Association of Colleges of Pharmacy surveys for faculty, for staff, for budget, for students. So a lot of these help us to really look at our curriculum and are we doing a good job, what needs to be emphasized and so on. And we also have our internal graduate exit survey. We're looking at student course evaluation and other things that we document: admissions criteria, financial stability, resources, library, IT, all of that. So I apologize. I hope I did not go too fast, but there's a lot to be covered, and some of these slides could be 1 hour by itself, but hopefully it gives you a really sense of what is needed to look at a curriculum in general, a vertical curriculum, what is the role of each one of us in our courses and so on, and hopefully that was beneficial. So in summary, I think it is important to design and develop a curriculum that addresses knowledge, skills, and attitude. I cannot overemphasize the importance of attitude. We need to encourage and reward innovations by faculty, because that really will always improve on our curriculum, ensures individual and accountability. We're all accountable. When the curriculum committee and the assessment committee work hard to develop this and we vote on it as a faculty, we need to be accountable. We need to support. We need to help in every way to really show that we have buy-in because we voted on it. And ultimately, we even, when it comes, I understand in Iraq and maybe other countries, the government can decide on these things. I hope that there is experts from University of Baghdad and others that really help to make this, at least to the best they can, applicable to the program and so on, rather than it's coming from higher up, that it is including the input that will help your students and others. Ensure vertical and horizontal integration, which is ultimately really help and lend itself to an integrated curriculum. Identify and caters for potential new job opportunities. Please, for somebody who spent 28 years in the United States, everything is about clinical pharmacy. We cannot afford that, whether in the United States even or here, the job opportunities and so on. We need to think out of the box in terms of how our pharmacy curriculum can help beyond clinical pharmacy and include the areas in the curriculum that will help and build it vertically to help that. Again, assessment is so critical throughout: formative, summative, standardized, and comparative assessments. I apologize. I used to remember how many pharmacy schools in Iraq, I believe 7 or 8, or am I wrong?
Pharmacy schools in Iraq?
Yes.
More than 40.
Oh, 40? Oh my God. My apologies. I don't know what I was thinking. Maybe I was thinking about the United Arab Emirates, but my apologies. But anyway, I mean, there's such rich information among the 40. And if there is a licensure exam where they all take it, how can you really look at your students if that exam is validated and so on? There's such rich information to look at across the board. Where is the University of Baghdad? compared to the other schools? What can we learn? How can we help each other? And that gives you an idea how your curriculum is working. Please, for each one of us, and as a curriculum committee, we need to help our students. Our pharmacy curriculum is so loaded with so much knowledge, so much content. They're overwhelmed in so many ways. We need to always evaluate what we need to take out of the curriculum, how we can teach certain concepts and so on, integrated with other concepts to decrease the workload and decrease the curriculum hoarding that we continue to do by adding without removing. So very critical, very important. And that's what it looks like in an apartment where somebody just, I don't know if you've seen some of the movies or shows about people that hoards everything. So they live in a room with just all kind of stuff. So that's how I compare curriculum hoarding. Ultimately, again, in Iraq, Lebanon, Urdun, Palestine, everywhere, we need to prepare graduates for current and future practice. We want to do it in an efficient, streamlined process. And we want to do a well thought out curriculum mapping to include, again, the kind of knowledge and skills and attitudes that we need so our students can excel in their own neighborhood where they will practice and at the level of Iraq based on the needs of Iraq for what pharmacists should be doing. So with that, shukran, ya'atikum al-afiyah. I'm sorry if I took more than I should. And thank you very much. And I'm happy to address any questions.
Thank you, Dr. Naser. We can't thank you enough. As usual, the workshop far exceeded the expectations in terms of content and being really on topic. I just want to remind the audience there is a attendance link in the chat box. Please fill that, even if you're not interested in the certificate, because that helps with the workshop analytics. And before we open it for the mics, there are a few comments or a few questions in the chat box. That's additional to the so many comments really complimenting the workshop, Dr. Naser. The first comment is from Dr. Haidar Tukmachi, who is a former dean of one of the reputable colleges of pharmacy in Iraq. So he's saying, first, many thanks for the valuable lecture. I think that you mentioned an important point concerning subspecialty pharmacists. Here in Iraq, we are in a high need to subspecialty, and we truly are. But we have a problem in job description as a part of the law in Iraq. And at the point here, we don't have the availability and the ability, I think, to change the curriculum in our School of Pharmacy. It's a ministerial issue. And that's really true. So our curriculum has to be approved by the ministry, and to really update it, it takes very, very long time. Although I know many instructors are trying to work within the allowed limit to be free in kind of adding to the curriculum and taking out of it. But yes, everyone is admitting the need to update the curriculum substantially, but we are kind of faced by the laws.
If I may
second
make
question
a comment,
is,
Dr. Kauthar,
yeah?
about this.
Sure.
You know, this is no different than what it was in the United States. In the United States, about 50 years ago, just about, pharmacists were not allowed to speak to patients about their drugs. And it took, a while for, things to happen. And even in the United States, still with all this clinical pharmacy, pharmacists still not able to prescribe, very limited. In Canada, in Australia, they've done, even in England, they've done a better job with pharmacists prescribing and so on. So the key thing, I think, with any kind of country is advocacy. That's why advocacy is becoming so important, even in the United States, for the students. How do we advocate? In fact, we are going to get a judge who is retired in our jurisprudence course, who worked in the parliament in Lebanon and knows how to really kind of work with the members of parliament to help our students to, if we want to change the statutes for pharmacy practice in Lebanon, how do we do that? they need to be savvy about how to do that. Yes, there is limitations, but it shouldn't stop us from doing the things that need to be done to change the status quo, to collect data to show that when pharmacists act in certain areas, patients with asthma or patients with diabetes, that asthmatic patients with asthma don't end up going to the hospital as much because the pharmacists are helping them. Diabetes, that when they are monitored by a pharmacist, the A1C will be below 6 or even, dropping at 1 or 2 every 6 months. So again, we should not, sadly, yes, there's limitations in الدول العربية even more, but we need to continue to advocate for what we do, and God willing, to show the value to the Ministry of Health and Labor and others, so that, God willing, we can change the scope of practice of our graduating pharmacists. It sounds a little bit idealistic, but there is no other way. There is no other way. We have to do that.
Very well said, agreed. I have a question from Dr. Daya. What is the minimum number of credit hours for a PharmD program?
The PharmD program, the 4 years without the pre-pharmacy, I believe ours was 127.
Yeah, that was mentioned in the slides. But is there like a
127 or
minimum?
132? Sorry, go ahead.
Is there a minimum?
I don't believe so. ACPE, I have to go back. My goodness, we just finished the ACPE accreditation. I mean, I know we have at least 126 hours. And of course, the experiential experience, we have a whole year of experiential with about 1,570 hours of experiential experience hours in the last year.
Okay. Dr. Ali, I think you can open the mic.
Thank you so much, Dr. Assalamu alaikum, Dr. Naser. Thank you so much. You are great as usual.
Allah yakhlīk, tislam.
Very great to have you. Dr. Naser, related to the type of curriculum you use in the Lebanese International University, do you use the integrated one? And the other question about Dr. Haidar, he mentioned we have difficulties, and we all agree about the central authority of the Ministry of Higher Education, and we need to follow the rules before we change something. For now, what should we do if, like in the US, they have NABLEX, and they usually map their curriculum with NABLEX, which is the Board of Pharmacy exam. In Iraq, actually, we don't have such exam yet for all the graduates. So how can we map our curriculum? Do we need to do, now we have more than one suggestion. One suggestion say we need to, for example, College of Medicine, they follow the module. They usually put module for cardiovascular, and within this module, they have different disciplines. They integrate the pharmacology, they integrate the other departments. So do you think, in Iraq, we don't have Board of Pharmacy exam? So on which phase, or how can we be guided to plan our curriculum? Which modules should we follow? How can we know our curriculum, the new one, will be better than the previous one? I know the assessment, but for example, now if we need to sit and we need to remap our curriculum, in which direction should we go? I'm not sure if this question is clear. Thank you.
No, thank you very much, Dr. Ali. Your first question about LAU, I came in and they actually have the IRA model, excuse me, for the curriculum. And in fact, when I came for my interview last year, they had, believe it or not, a huge conference room, and they had the Excel spreadsheet. They printed it. It's huge. It's huge for the whole 4 years of the curriculum, and on it, they put where the I is, where the R is, where the A is. It was fascinating. We did something similar for our program, but we didn't build this huge, I mean, you're talking as big as the conference table, which is huge. And people were actually putting the I, the R from the different courses, and that's how they built it after they put it on paper. And when they had their accreditation, actually, the ACPE commended them based on, because they did it almost manually on paper, but also they did it with this big, huge. So as an exercise, it can be done. And as long as you continue to assess that people are introducing, reinforcing, communicating on a semester by semester level. In fact, when I came, that is something that I introduced, that there will be communication between all the faculty that are teaching in the fall semester, spring, to share experience, and then to share it with the curriculum committee and the assessment, and that we're going to have a joint curriculum assessment committee at the end of each year to summarize what lessons have been learned and how the curriculum should be modified based on what is discussed. So again, it takes a lot of effort, commitment, but it can work. Now, you mentioned, my apologies, 40 schools. I will tell you this. My mission coming to this part of the world is, God willing, that we can establish an Arab competency-based curriculum standards that we all can be proud of, all right? I've been in touch with Dr. Lama, who's the الأمين العام بتاع الجمعيات العرب, كليات الصيدلة العرب. Maybe we're still hoping to still meet بالعين after their conference, the assessment. But if not, I share that I'm more than happy that we host at LAU with, inshallah, إنه yes بدنا العملاء يجوا, but إنه people that are doing assessment بجامعة بغداد, بجامعات بمصر وكذا, إنه يجي to sit down and can we really collectively establish, why do we need to think about ACPE or anybody? I know external, is important and everybody's running after it, but God willing, maybe that will be something we could do. But I will tell you, getting the 4 schools with LAU also is, تعرف الدكتور محمد رحال, and he and I, we will be doing the same exercise مع الدكاترة التانيين تاعون ال4 جامعات بلبنان. I wish that somebody is a champion بالعراق to sit down and say, you know what, جامعة بغداد ما شاء الله الهيستوري العراقة اللي عندكم والكذا, to say, you know what, we're going to host such a conference to really look at collectively what would be standards under education, under students, under assessment. The criteria are not difficult. We know what we need to set standards for. I addressed a lot of them. Many of them are ACPE based, but quite a few are my own experience. So I would encourage you, really be champions, call for a conference, invite the people that really want to come to establish the quality indicators for what should be pharmacy education in Iraq. And God willing, the ministry will come aboard, invite them, let them put their input. But I know, again, I might sound idealistic, but we need as educators to be champions to do what needs to be done. Yes, there might be barriers, obstacles for implementation, but at least it shouldn't stop us from getting to a point where we did our part, and then can we get the support from the regulators, from the ministries, and hopefully step by step you can. I hope that answers your question.
Thank you so much, Dr. Naser. Appreciate it.
Thank you, Dr. Naser. And I hope you still have a few minutes for questions. Would that be okay?
Definitely, yes.
So you talked about the role of alumni in updating the curriculum. The question is, how far alumni to be reached? You know, like, should we reach the alumni from 5 years, 10 years? How do you kind of organize? Is that like how do you work that at LAU at least?
Oh, absolutely. I've been very fortunate to connect with our alumni. I sent an email titled Staying Connected. And in that, I kind of explained my philosophy and all that stuff, and then told them what I would love in terms of their contribution. I will tell you, we have amazing, amazing alumni, and they're in all aspects of pharmacy settings. And for Pharmacist Day, we ended up inviting 5 of them in different pharmacy settings in Lebanon, from the industry, the ministry, community, hospital, and informatics and digital health. It was amazing. So I think the key thing, again, when you are in touch, connected with your alumni, you get to know them. We also did, and the university supported us with having the first annual pharmacy alumni reunion on campus, and we had almost 100 alumni here from Lebanon. Many that are in France and England and the United States, Canada, they were emailing that they were so disappointed that they could not. So, alumni are such a critical part of what we do. They're in different settings. They can contribute. And like now, we're going to have a wonderful colleague from one of the drug companies teaching in our master's program in industrial pharmacy, and she's going to teach in our curriculum. So you really need to, again, connect with them, do some activities to show them that we appreciate them, they have value, and so on. Invite the key ones that you identify to be on the curriculum committee to really provide their insights where the pharmacy profession is going, whether it's community pharmacy, hospital, presidents of companies, have them as advisory. I establish an advisory committee with key pharmacy people here in Lebanon. Those also give you input in terms of what the curriculum should be. And you don't even need them to be official in a sense. When you have functions, conferences, and so on, I've been to so many conferences here in Lebanon and met amazing alumni. Talk to them, ask them what they think, what their feel the profession is going, and so on. So there are many, many ways to get input from alumni. Does that help?
Thank you. Yes, very much. Thank you. Then you talked about the soft chalk, and I quickly Googled it, but then I want to ask you, is that something, you said you're connecting it to previous notes? Is that like connected to other instructors' notes, or you look for
Yes.
resources to?
Believe it or not, yes, it is connected to like physiology, anatomy, PowerPoints from the faculty that are teaching. You have to ask their requests. And I met with, when we bought the software, I explained what I'm doing with the software. So I met with them, and some actually, believe it or not, did not feel comfortable with it, which is fine.
I would. That's why I'm asking, like, because not everyone is comfortable just sharing their content,
Yeah, absolutely. But the key thing is there are so many reputable sites, that you can go from the FDA, you can go to the CDC, you can go to other, there is so many open, education channels for many good universities and so on, that you can access lectures and so on, videos on YouTube by, reputable people. So it's not only even about those kind of things. Like when I teach the psychotic drugs and tricyclic antidepressants, I put movies that help the students recognize side effects from drugs. There is the movie Awakening that talks about the use of dopamine to help patients.
So it's a content for one course, but then the instructor can integrate other courses within or rely on external sources.
Absolutely.
That's like
I actually submitted a proposal for the curriculum committee so that we integrate all our courses as such. And unfortunately, it did not go through. But I always feel if we can, as faculty, sit down and really do our lectures like this and link to each other, what an amazing curriculum that would be, because the students, when they're learning, they're really integrating all the time because we're working collectively to build each lesson and helping the students to go back. And the pop-ups are really critical because they don't remember what an agonist is, so they hover over it. An agonist and antagonist, intrinsic sympathomimetic activity. So it makes it so rich, amazingly rich. And the activities, the flashcards, crossroad puzzles. Some of the learning management systems can do that. I don't know if you use Blackboard or whatever learning management, but some of them can help with some kind of authoring similar, but it's not really as good as the software. I love the software, it's amazing. And I still, even when I came here, because I love to teach, even though, as a dean, they don't require you to teach much, but I did pay for the software to continue using it. It's $599 every year for an individual. They do charge for like 10 or 20 users. I don't know exactly how many, but
for individual, you mean an instructor?
Yes, like mine is only an individual one. At Creighton, some of the faculty, the medical faculty, they vested in it. So at least we had, I believe, a discount because of that.
Well, good luck with that. It appears really good. So I guess we don't have any more questions, and that brings us to the end of this workshop. And at the end, really can't thank you enough, Dr. Naser, and thank all the audience. شكرا جزيلا لجميع الحضور. شكرا لعمادة كلية الصيدلة، أستاذ مساعد دكتور سرمد الخطيب على دعمهم المستمر لهذه الورش. شكرا لوحدة التعليم المستمر دكتورة زهراء، ووحدة ابن سينا دكتورة سليمة وست وفاء على دائما دعمهم لجميع الورش الإلكترونية. شكرا لضيفنا المتميز دائما بروفيسور ناصر الشريف عميد كلية الصيدلة في جامعة اللبنانية الأمريكية. شكرا لجميع حضورنا. شكرا دكتور ناصر، نورتنا. إن شاء الله نلتقيكم في ورش أخرى تخص From now on, you're only with me for quality assurance because now I'm on quality assurance. So a lot of the topics I'll be inviting you for will be on that topic.
إحنا ننفذ.
الله يسلمك دكتور ناصر.
شكرا لك
شكرا لك. شكرا
العافية وشكرا للجميع لحضورهم.
شكرا جزيلا دكتور ناصر.
الله يخليك، تسلم. حبعت لك الباوربوينت والايميل تاعي.
يا ريت.
وإذا حدا في أي سؤال أي شغلة، وإذا بنقدر نخدم بأي شغلة بالعراق.
So the recording will be available publicly on YouTube, on the YouTube channel for the college.
Absolutely.
And we have your permission to share the slides with whomever would request that.
Absolutely.
Thank you very much.
عفوا الدكتور عنده. شكرا دكتور. عفوا.
نعم دكتور سنة.
العفو الدكتور عنده يعني قناة خاصة على اليوتيوب. عفوا.
لا على قناة الكلية دكتور، يعني التسجيل دكتورة سليمة ترفع على قناة اليوتيوب الخاصة بالكلية.
يعني هاي المحاضرات كلها موجودة حتكون إن شاء الله
على قناة اليوتيوب الخاصة بالكلية، على البلاي ليست الخاصة بالتعليم المستمر.
نعم نشكر للدكتور طبعا، شكر جزيل للدكتور أيضا، يعني تحياتنا دكتور إن شاء الله. السلام عليكم.
السلام دكتور كوثر، شكرا لك.
مع السلامة دكتور ناصر، شكرا جزيلا.